Welcome everybody. My name is Gary Famartino. I'm the administrator here at St.Fishers Hospital. And I want to welcome everybody to this great event, the Drive for Men's Health. And this event started with Dr. Brombart and Dr. Pericati, who are from Central Florida. And these two gentlemen, both urologists, started this last year in a drive with their all-electric Tesla car, all the way from Florida all the way to New York. And this year they're taking it even further. They're going from Central Florida all the way to LA. So we are excited in partnership with them to bring to the attention to this community, as they are doing at all of their stops, the Drive for Men's Health and prostate awareness, the importance of getting screening for preventing prostate cancer and other screenings that are here today. So we welcome both of our urologists, and we also want to thank our urology associates, our partnership with them, Dr. Kim, Dr. Williams, Dr. Hall, who really made the connection here with these two great physicians from Central Florida. So welcome everybody. It's going to be exciting. We're going to have some education here about what we got to look for as screening and really have some fun here too. So thank you all. Appreciate it.
I'm Fouad Hamoudi. I'm the Executive Director for Cancer Care for St. Vincent. And at St. V, we are really committed to treating the whole body, mind, and spirit. And obviously, screening and health awareness is key to any patients or anybody in order to be detected early. The earlier we detect potentially cancer, the more that the patients can live a better life and be cancer-free. So we're excited about this opportunity. This is a unique way to bring that awareness, especially to men. We all know men are very stubborn when it comes to going to the doctor or getting screening. So this is really exciting to be a part of this. And we welcome both our physicians here and support from our urology group to do this. So let me welcome Dr. Pericati and Dr. Brombart to start their, help me welcome them up here. Thank you.
Good morning. I know it's been a very chaotic morning. We apologize, but we do tend to do this when we go to our stops.
We're a little bit crazy.
But we want to, before we get started, we keep hearing this name, Dr. Hall, and Dr. Hall cannot physically be here with us, but he's going to say a few words, if you guys don't mind. Dr. Hall, can you hear us? Can you hear us, buddy?
I hear you just fine. Can you hear me?
All right, go ahead. You got 2 minutes, man. Tell us, where are you?
All right, hey, yeah, I just want to thank you guys for letting me live stream in here. Unfortunately, I was unable to be with you guys. I'm dealing with some extenuating family circumstances out of state. But this whole event is about taking technology and making it cool and useful for men's health. So thankfully, I'm able to be there with Google Hangout, Periscope, and you name it. So just want to start by thanking St. Vincent Health, Tesla Motors of Keystone, the Indiana Pacers, all the volunteers, all the guests there, my partners, for just making this event a reality and what looks like a success. It's an honor to be part of this, second annual event, which is as Gina says, big ideas change the world, and this is a big idea, and I think each year is just going to be even better. So, Men's Health Awareness Month and Week really stemmed out of Congress back in the 90s, and I don't know how many of you guys know this, but Congress realized that the typical man move is just to ignore our health. I do it. I think every other male in that room does it. And, we're more interested in sports, women, cars, other extracurricular activities that we just really totally ignore, symptoms, signs, screenings, you name it. And this event stems out of that awareness in June. And so, again, I met Gene and actually on social media over the last couple of years. We've used Twitter and Facebook and Periscope and
I was stalking you because
Google
you're so much more advanced at this than we are.
Men's health awareness. We've just really kind of wrapped ourselves around that cause and that medium. And I'm thankful so much that you guys took your time out of your tourist stop here. We're honored to have you guys, and just excited to be a part of this nationwide event to just get in talking about their health and hopefully make positive change. And so with that, I thank you, and I welcome you guys, Dr. Jane and Cijo. And again, I'm sorry I can't be there.
Well, thank you so much,
David. So as he talked about statistics, let's give you some of our numbers here. We haven't killed each other yet. We've been driving now 7 days. This is a 10-day journey, over 6,000 miles. And we started, when? In Florida. Yeah, we started at South Lake Hospital, which is affiliated with Orlando Health, on June 11th. And then we went all the way up the East Coast, and now we're doing something even crazier, which is
going cross-country all the way to LA. And we're hoping to do this every year and just get this bigger and bigger. And the whole idea is just to get guys to do a double take, and maybe when they Google about a Tesla or some cool cars, they'll get a little bit of education on the side to maybe think about making that, picking up the phone and making that appointment to see their doctor. And we've had some interesting experiences.
No, we won't talk about those interesting. You have to follow us on social media to see all the interesting things that have been happening to us. So you can go to Drive for Men's Health. You can follow us on Twitter, Instagram, Periscope, and Facebook as well. But Dr. Hall brought up some statistics. Now we're going to do a little pop quiz here. In 1920, can you guys guess what the life expectancy gap was between men and women?
Any guesses?
I'll give you 1, 5, or 10 years. 10? 10? It was only 1 year. Now, today, what do you think the gap is today? We have the best hospitals, the best medicines, the best doctors. What do you think the gap is today? 10? 9? It's 5 years. So still, even though we're all living longer, us as guys are living less. And if you look at the top 10 causes of death in America, men are more likely to die of 9 out of 10 of them. Guys, this is horrible. I want to be there and watch and pay for my daughter's wedding.
He really does want to pay for it.
I have 3 of them.
He's got 3 daughters.
I want to see my grandkids, and men just don't realize is, we're all about short-term gain, and we actually did a survey through Orlando Health, which Cijo will talk about, as to what guys' priorities are.
So it's really interesting. We surveyed 1,000 men, and this was through Orlando Health and South Lake Hospital, and we surveyed 1,000 men, and there were just 2 simple questions. So the first question was, do you remember the name, make, and model and year of your first car? And
do you remember, Gary?
Do you guys?
Dodge Century?
How about you, Dr. Kim?
Yeah. What about you, Cijo? What was your first car? I know it wasn't a Tesla.
Mine was a ’88 Sentra, and the rear windows couldn't open, so it tended to overheat. So it was a lot of fun driving that car.
And mine was a Camry.
So we can remember those details with crystal clear clarity. The second question was, do you remember the last time you went in for your primary care or physical visit?
Gary, we won't ask you that question.
and less than half of the guys could remember that. And it just shows you that, we do have a tendency to focus on things that we really enjoy. Cars are cool, they're neat, they're interesting, and we're very good about being on top of checking the oil and taking in for maintenance. But what if we think about our bodies the same way? We only have one body. A car you can replace, you can buy a new one, but what about your own body? And what we were trying to emphasize with this whole move is just for guys to do a double take and say, you know what? When I think about my car, maybe I'll think about picking up that phone and making that appointment and going in to see my primary doctor, because we want to pick up on those issues. We want to do that screening before you have a problem to take care of that body.
Yeah, and there's lots of things you can do for screening. I mean, you don't have to be 50 or 60 to start going to see a doctor. Guidelines say even if you're as young as 20, you should be going at least once a year, whether it's just a hello to your healthcare professional. And when we say healthcare professionals, it's not just doctors. There's nurse practitioners, PAs, there's walk-in clinics. There's so many avenues that you can find healthcare education. The screenings could be lab work, could be blood pressure checks, could be just a hello or a physical examination. These are very important. But what if we know there's guys out there that will still not do this? So what we're doing on this drive is essentially showing you things that you can do at home that you can use as screening techniques. And we're very fortunate to have a crew of 12. Can you guys all give them a round of applause that travel with us? And one of those guys is actually someone that's a little mad at me right now because he's actually our personal trainer, and he's a physiotherapist that comes with us. I haven't been going for like 3 months because
So I don't know if you saw our postings yesterday. We did our first exercise session for like
Come on, Carl.
5 minutes with it.
So what we like to do at each stop is not just talk about the drive or the car, but we want to provide some education. So we're going to have Carl tell you about how something as simple as a string will be able to help you kind of screen yourself at home. And then Dr. Pericalo is going to talk about some interventions for enlarged prostate. So Carl?
Thank you. I'm an exercise physiologist at South Lake Hospital, with Dr. Pericalo and Pericalo, excuse me, Dr. Pericalo and Dr. Bromhot.
It's a good Irish name, but no one believes me.
So I wanted to just demonstrate an easy way to screen yourself instead of BMI. And I'm actually gonna have Jonathan, DJ Doctor, come up here and demonstrate this test. Basically, BMI has been kind of criticized over the years for being an overly simplistic measurement. It's a kilograms over meters squared, so your weight over your meters over your height, and that isn't the best indicator necessarily of what type of body fat you might have, or if you're particularly athletic, maybe you have a higher BMI and that's not indicative of your overall health. So some researchers got together and determined that the string test, which I'll show you in just a minute, is actually a better indicator of that, and there's a reason for that. We actually measure the waist measurement, which is actually here around the umbilicus, rather than where we think it is down on our hips. And if the ratio to our height to our waist is greater than 0.5, meaning that our height is more than double our waist size is less than double our height, then that's an indicator of visceral obesity, and that's an indicator of high cholesterol and high blood pressure. Excuse me. So I'm going to demonstrate this on Jonathan very quick. This is something that you could do at home, which is simply with a piece of string. So all I'm doing is getting his height real quick. Okay. And then I'm going to fold the string in half, matching up the ends. And as long as this fits comfortably around Jonathan's waist, then he doesn't have, it's not an indicator for high blood pressure or high cholesterol. Now Jonathan's got some room to give in that, and this might be a wake-up call for many of our men out there who are storing a more dangerous type of body fat, which is around the abdomen. Fortunately, though, it is a more metabolically active body fat, so it is easier to lose, but it still is dangerous because it's close to vital organs. So if you can get your guys out there to just do this quick, simple test, non-invasive, that's very, very good. We also have screenings happening right now. I talked to Kia this morning over in the next room, who's doing a body fat analysis, a BMI analysis, and so check that out and compare it to the string test, and I'll be around with the piece of string to help you out with that. So thank you very much.
And next, we'd like to invite Dr. Samuel Kim, who's going to talk a little bit about enlarged prostate and what that is and how it can be treated.
Thanks, Ken, for having me. Sorry that Dr. Hall couldn't be here. We always talk about prostate cancer, and prostate cancer gets a lot of press. But the prostate can actually cause other troubles, not necessarily cancerous. So how many people get up at night to go urinate? Probably everybody once, twice. Have you ever gone to a movie theater and not been able to sit through a whole movie? Those are simple questions. Some people may get up 2 times during a movie. Some people get up 3 times at night. And that could be symptoms of what's called BPH, or benign prostatic hyperplasia, or an enlarged prostate. And things like kidney failure, urinary tract infections can occur. And we don't really talk about that because cancer gets the big press. So one of the things is prostate cancer doesn't always have symptoms. It's found with a blood test or by a finger exam if there's a nodule there, but prostate troubles or benign disease can come from that. So there are many solutions, some of it medical, some of it surgical, some of it with surgical procedures like the UroLift and surgery with the laser. So there are many processes that can be addressed. But again, it comes down to guys, we got to go in and get checked out. As I said before, hospitals build women's hospitals because women go see the physician. So if you have any of those symptoms, I encourage you to look at that. It may be as simple as a small pill that might help you get up less at night, go better, have a stronger stream. But again, those are things we don't want to talk about. It doesn't get the press. But I encourage all of you out there, if you have any troubles, especially those guys over 50, over 60, you're getting up once, maybe twice, maybe 3 times now, get checked out. So those are things to look for, and we'd be happy to help anytime.
Excellent. And I think as guys, we tend to be creatures of habit, and you get used to the way things are going. And I always tell patients that you got to think back to how you used to pee when you were 10 or 15 or 16 years old. Do you pee across the street, or can you reach that goal? And so, because we get used to just a gradual decline in the stream or the force. And so the idea is that there's a lot of treatments out there that we can do for these. One of the newer treatments is a device called UroLift. And UroLift is very unique because it's almost a way to open up the prostate without doing any major surgery. The classic treatments we have for the prostate were coring out the prostate, and a lot of patients affectionately call it the Roto-Rooter surgery, where you go in and core out the inner part of the prostate, and it allows you to urinate a lot better. But there are some side effects from that procedure, and so there's been evolution in the technology that we use for these kind of conditions. And UroLift is a way to almost tack the prostate open to get the same effect without any of the sexual side effects or any other adverse reactions like that, and so it has a lot of potential. But the most important thing really is for guys out there is that if you have any of these symptoms, to reach out to a physician that you feel comfortable with. Most of your primary care doctors can actually handle starting you with the medication treatments and stuff, and then you can go on to see a specialist, urologist who specializes in that area. But the key thing is to not accept things the way they are. We can sometimes make it better and go from there.
So we have a question on social media, and you mentioned enlarged prostate. There's a lot of, and we get this every stop, is cancer versus enlarged prostate. And the question is, how do I know my husband does not have prostate cancer when he has trouble peeing? Dr. Kim, I don't know if you want to take a tackle at that? Or?
Sure. I think typically prostate cancer doesn't always cause symptoms, but you can have symptoms from an enlarged prostate. So although the symptoms might be fairly benign, meaning getting up at night, I think that is something that only a physician can really help you with, usually with a blood test called a PSA, and sometimes with a digital exam, which most guys don't want to do, but is very helpful, and that's part of the exam. So I would encourage that person to encourage their husband, their boyfriend, their friend to go get checked out, because there really is no way other than having a physician evaluate you. So great question.
So I know there's been a lot of controversy about PSA screening. And as urologists, we're big fans of screening. I mean, we see it every day, guys that are not getting their screening. And it's not just a lab test, it's also a physical exam, which I know we regret, but it's something that your primary care doctor can do as well. The second question was how to prevent kidney stones, because it is getting warm. And we get this question asked all the time. I don't know if one of you guys want to take a tackle at that.
I guess, go ahead, Dr.
Kidney stones are sort of a disease that can affect anybody, men and women, but especially men. If you look at historically, it's affected men in warmer climates, and you brought up nicely that when you get dehydrated, that's a good time, unfortunately, for kidney stones to form. So really the simplest and cheapest thing I tell patients is to drink fluids. And the best way is if you look at your urine and it looks radioactive, whatever color it may be, you're not drinking enough. So in the summertime, you probably need more fluid. You might need 12 or 14 glasses of water. In the winter, you might need 8 or 6 glasses. So you really have to take in as much water as your body needs. That's the simplest thing. There are medications. There are watching your salt intake, limiting your dairy products to 2 servings a day. Again, those are calcium stones. Those are 75% of the stones that are out there. But the simplest thing is probably just drink more water and stay well hydrated.
Yeah, I think hydration is the key, and we always tell patients that you want to make sure that your urine is almost clear to colorless, and that tells you that you're hydrating well or sufficiently. So really is important for all of us, even when we travel and stuff, to hydrate and drink lots of fluids. Water is the best thing.
So one question we always get asked is how do I've been showing my husband everything you guys are doing, but I'm still having a hard time getting him into the hospital, the doctor. I was gonna have Gary kind of try to tackle that question, because it's kind of an outsider's point of view, outside the
Absolutely.
And then I would just love to hear your thoughts.
Well, that's a great question. I mean, and I think guys are notorious for putting off things. They won't put off their oil change in their car. I can tell you that much. I'm like that. But, I think you need to, you got to keep on them. You got to, point them in the direction of saying, you want to see your children grow up and enjoy their weddings, enjoy your grandchildren and that. And everybody needs to take an active part in getting the screening and seeing their primary care physician first and foremost, and getting in there. Just it doesn't take much just to start it, but delaying it could be just absolutely catastrophic. So, we encourage everybody to try to, at a certain age, you got to get out there, see your doctor, get your physical, get the screening necessary, and these are things that if you catch anything early enough, it can be prevented. So all I would say to anybody that has a stubborn guy in their life is, turn on the tears or whatever you got to do, but get them out there and keep pushing that battle.
So I got married 10 years ago. I have a personal story. I got married 10 years ago. We celebrated our 10th anniversary. I hadn't seen a doctor at all. Residency, training, fellowship. My wife said, you need to go see a doctor. I'm like, no, I'm a doctor. I know what I'm doing. I'm in good shape. I go see the doctor. I'm 50 pounds overweight. My cholesterol's 350. No idea. I'm a physician. So she made me go see a physician, and from then I lost the 50 pounds. My cholesterol's normal now. So, married guys, behind every married man is a better woman, they say, right? So one of the things I thought about was, you want to see your 3 daughters get married. I want to see my 4 kids get married. And
I don't want to pay for it, but
I don't. I only have one daughter. I only have one daughter, so I only have one.
I want to see my 4 boys get jobs.
So even as physicians, we're just as guilty as anybody else. So I completely agree. Get out there.
You bring up a great point. Is if we're going to try to be the models of men's health, then we also have to be the role models. Like when you see a heart doctor that may be obese himself, or when you see a urologist that goes to the bathroom 10 times in between your 15-minute clinic appointment, it gets frustrating for the patient as well. So, we're also encouraging, and I'm very happy to hear your story. That's why we have Carl with us to beat us down when we want to go to Taco Bell. He makes us go to the local salad shop instead. So thank you, Carl, for always being our motivator. He knows we don't always follow his advice, but we try. We're guys, man. So I want to tell you guys about social media, and I think your hospital is fantastic in engaging all of our social media efforts. How do you see social media kind of expanding in the hospital system to encourage not just men, but families and wives and women to come and engage more in their health?
Well, I see it through, the youth. There's not a young person out there that isn't connected with every single social media out there, and and it's starting to obviously transfer into the older adults. I am a big user of it. Our marketing team here, I think probably 2/3 of their focus is on those connections to social media, because it's not the old directives of the TV or the radio spots and stuff like that. Those are still important, but everybody has a smartphone pretty much right now, and the connection is wherever you go, wherever you have that, there is an opportunity to educate yourself and be connected. So it is vital to our future in getting words like this, getting education out to the population.
And what's really cool is you see that big sign over there, the urology doc. He actually has his own. He's very heavy into medical apps, and he has his whole blog and form. That's actually how I found him, because I had to write a blog, and I'm like, let me go see how other people write, and boom, his blogs are right there, and he does a fantastic job. So you have local physicians, local advocates, local drivers for men's health right at the fingertips. So anyone out here locally or nationally, I think he has 10,000 people that have downloaded that app. That is very impressive. Does anybody in the audience have any questions? No? So Joe, one question was, how is it like driving the Tesla?
It truly is very addictive. So So it's very fast. It's an electric car, so it's kind of like a jazzed up golf cart. When you I tell everyone, when you buy a Tesla, it's like buying into a new religion. It's a different way of life, and it really makes you do a double take on how we think about energy consumption. The car has about 450 pounds of torque, and it's an electric motor, so it just takes off right when you step on the accelerator. It definitely makes you smile each time. And so, unfortunately, I've had one or two little fender benders, so my wife says...
But that's why we got the decals, so no one
That's
can
right.
see
So
that.
my wife tells me it makes me smile too much, so I've been trying not to smile as much and focus more on the driving. But the key is, truly is what I like about it is it's American-made, it's American innovation. It challenges the norms. It's thinking outside the box and using science and technology to get a better outcome. And that's why I think nothing symbolizes what we're trying to achieve any better than this car, because it symbolizes that same mentality and that vision. And so, I really think that all of us really want to strive to making new and innovative and creative solutions for our patients, creating new ways to communicate with patients, be it through social media, to change the traditional model of going in to see your physician at the office. I think that if we can get a better outcome for our patients and do a better job with connecting with them, that's part of the battle.
Another thing that the Tesla folks, and they don't sponsor our drive, we just love the car, is their patents are wide open. So that shows that they're willing to collaborate. And it's the same thing that's happening here today. It's collaboration with institutions like yourself here at St. Fishers, with individual practices, individual clinics. I mean, we're just very blessed that you gave us the opportunity to come here and be a part of this. So it shows that your town cares, your community cares, and you guys care about men's health overall. So thank you guys very much. I think they deserve a round of applause, the entire hospital system here. So what we're going to do is two things. We're going to have you sign the card, and then we're going to take a group picture. If there's anyone that wants to be in this picture, please group them in. We'll take it in the next 30 seconds. And then hopefully Sidge will be able to drive the car out without breaking anything. All right. Thank you guys so much. Follow us at driveformenshealth.com or at drive4men on all of our social media feeds. Thank you.
Doctor, you're driving across the country in this Tesla. Tell us a little bit about the car.
So this car is incredibly addictive. It's an all-electric car. Basically there's no oil, no fuel, no transmission fluid.
It's a computer.
It's a fancy